Welcome everyone to today's webinar, Steps All Employers Can Take to Reduce Workers' Risk of Exposure to SARS-CoV-2, or better known as COVID-19. Presented by Brian Brocker, Dane Sprankle, Richard Mason from the IEP's Pennsylvania OSHA Consultation Program. The general format is going to be a PowerPoint presentation as demonstrated on the next slide. In that presentation, we'll have opportunity for questions and answers. The questions are going to be in a chat format, and the chat is open to submit questions. We'll be answering questions through this chat feature. If due to technical nature of the question, a more thorough response is required, we will post the answer on our website within 7 days of the webinar. I'm getting into the presentation slides. So a little bit of background. We followed OSHA's new document 3990-3/2020. It's entitled Guidance on Preparing Workplaces for COVID-19, and our information inserted from a section of this document. The document is quite long, but we wanted to get the main part for employers. When talking about the steps all employers can take to reduce workers' risk of exposure to virus SARS-CoV-2, or more commonly known as COVID-19, we break it into 6 basic steps with some overlap between them. Step 1, develop an infectious disease preparedness and response plan. 2, prepare to implement basic infection prevention measures. 3, develop policies and procedures for prompt identification and isolation of sick people, if appropriate. 4, develop, implement, and communicate about workplace flexibilities and protections. 5, implement workplace controls. And 6, follow existing OSHA standards. So that'll be the areas we cover today in the presentation. The first step is to develop infectious disease preparedness response plan. If one does not already exist, develop an infectious disease preparedness response plan that can help guide, protect actions against COVID-19. Stay abreast of guidance from federal, state, local, tribal, and territorial health agencies. Consider how to incorporate those recommendations and resources into workplace-specific programs. Consider and address the level of risk associated with various work sites and job tasks that workers perform at your site. Such considerations may include where, how, and what sources of SARS-CoV-2 or COVID-19 might workers be exposed, including the general public, customers, and co-workers, and sick individuals or those particularly high risk. For example, international travelers who have visited locations with widespread, sustained, ongoing COVID-19 transmission, or healthcare workers who have had unprotected exposures to people known to have or suspected of having COVID-19. On the next slide, we're continuing with the preparedness and response plan. We have non-occupational risk factors at home and community settings. So you're looking at both at home and community. Workers' individual risk factors, for example, older age or presence of chronic medical conditions, including immunocompromising conditions, pregnancy, heart conditions, lung conditions, diabetes, those kind of conditions. Controls necessary to address those risks. In the next slide, the plan also want to follow federal, state, local, tribal, and territorial recommendations regarding development of contingency plans for situations that may arise as a result of outbreaks, such as increased rates of worker absenteeism, the need for social distancing, including staggering work shifts, downsizing operations, delivering services remotely, and other exposure-reducing measures. Keep in mind options for conducting essential operations with reduced workforce, including cross-training workers across different jobs in order to continue operations to deliver surge services. Interrupted supply chains or delayed deliveries. Remember, the plan should also consider and address the other steps that employers can take to reduce the risk of worker exposure to COVID-19 in their workplace. You want to describe the sections and other sections in this presentation. The next slide, we're getting to the second step. We want to prepare and implement basic infection prevention measures. For most employers, protecting workers will depend on emphasizing basic infection prevention measures. As appropriate, all employers should implement good hygiene and infection control practices, including promote frequent and thorough hand washing. And if you're going to do this, you want to provide workers, customers, and worksite visitors with a place to conduct your hand washing. Excuse me. Part of that is you want to make sure you have soap and running water available. If not, have them if they're not immediately available, you want to have alcohol-based hand rubs that contain at least 60% alcohol. You want to encourage workers to stay at home if they're sick. Encourage respiratory etiquette, include covering coughs and sneezes. We talk about coughing in your elbow, your shoulder, as opposed to your hands, because your hands touch everything. You want to provide customers and the public with tissues and trash receptacles. You want that stuff laying around everywhere. Looking at the next slide for additional infection prevention measures, explore whether you can establish policies and practices such as flexible work shifts, such as telecommuting from home, and flexible work hours, staggering shifts. If you have a congested area during a normal daylight shift, maybe break the shifts up and cut the people down in half or into threes, so you can so you can separate the people by 6 feet. To increase physical distance among employees and between employees and others. If state and local authorities recommend the use of social distancing, you can do it upon your own, or if they're recommending you do that. You want to discourage workers from using other workers' phones, desks, offices, or other work tools and equipment when possible, such as limiting the use of machinery, have them work at one machine instead of bouncing back and forth, fork trucks, cranes, and other equipment. And when you exchange from one person to the other, conduct a wipe down or clean down of the equipment. Our next slide, we illustrate our prevention measures where you want to maintain regular housekeeping practices, including routine cleaning and disinfecting services, equipment, and other elements of the work environment. When choosing cleaning chemicals, consult information from the Environmental Protection Agency, or EPA, approved disinfectant labels with claims against emerging viral pathogens. Products with the EPA approved emerging viral pathogens claims are expected to be effective against SARS-CoV-2 based on data for harder to kill viruses. You want to follow the manufacturer's instructions for the use of all cleaning disinfection products. For example, you want to make sure if you're mixing products, you're mixing the right concentration, and the application is the method that they recommend, and you're using proper soak times or dry times on it before you dry it or clean it off. It says 5 minutes, you want to leave it there for 5 minutes, and make sure you're wearing the proper PPE. That was our first two steps all employees can take to reduce workers' exposure to SARS-CoV-2, COVID-19. Next, we'll have the third step provided by our next presenter.
Hi, my name is Dane Sprankle, and I will be covering the next several steps within the recommended guidelines that Brian went over at the beginning of the presentation. The first slide there addresses developing policies and procedures for prompt identification and isolation of sick people. This is a critical step, obviously, to prevent sick people from potentially bringing exposure to a workplace. So you need to make sure that the employees are aware of what the symptoms are, and make sure that they're self-monitoring, and develop procedures and policies that ensure that employees let the company know if they are experiencing symptoms of COVID, or even symptoms that maybe aren't directly related, or if they're not sure, that they do bring that to the company's attention. And for employees that show those potential signs and symptoms, they need to be isolated or ideally sent home. And the training aspect is probably the most critical here, because if employees don't know what to look for in themselves or who to report it to within the company, obviously that they would just come to work, and again you're right back to where you started in terms of having a potentially sick employee on the work site. So the last two bullets there: move potentially infectious people to a location away from workers. And some of these recommendations are more medical related in terms of the work site. Of course, with isolation rooms and things like that, you wouldn't expect to have something like that in a typical workplace, but a temporary room could be designated that if an employee would report symptoms, could be temporarily asked to wait in that area until the next step is taken in terms of what to do as far as moving, whether they would be sent home or sent to a local medical facility for evaluation. Okay, next slide. Take steps to limit the spread of secretions. And you're going to hear, you've already heard somewhat about face masks and respirators, and you're going to hear that repeatedly throughout this webinar. And I'm sure everybody has heard it repeatedly through media as well. So this is a critical, probably one of the most critical aspects outside of distancing of dealing with this situation. So provide a face mask if it's feasible and available, and ask the person to wear it if they're capable and willing to. And note that a face mask should not be confused with PPE for a worker. It's not the same as necessarily as a respirator that would fall under the PPE requirements of OSHA. It's more to prevent the employee that has the symptoms of sharing those secretions with others, as opposed to protecting them from being exposed to somebody who may have symptoms. So it's more to contain any liquid or secretions from escaping the person's mouth, nose, etc. Next slide. Okay, we're still on developing policies and procedures for prompt identification. So again, we mentioned about, if possible, isolating people. And it's, again, oriented more specifically toward medical facilities, nursing homes, hospitals, any medical office, frankly. And ideally, it would be a separate room entirely. At minimum, some type of barrier, even a plastic sheeting, temporary structure that you may want to instruct, and obviously restrict the number of people entering those areas to the bare minimum. Next slide. Protect workers who are in close contact, i.e. within 6 feet of a sick person, or who have prolonged or repeated contact with such persons, by using additional engineering controls, administrative controls, safe work practices, PPE, i.e. respirators, and workers whose activities involve close or prolonged repeated contact. There's more detail provided later within this PowerPoint. Next slide. Okay, the next category, the next step, is developing, implementing, and communicating flexibilities and protections for the workers and for the company as a whole. Again, a lot of redundant information in this webinar, because the more times you hear it, the better your chance of remembering it. So obviously actively encourage sick employees to stay home. Ensure that sick leave policies are flexible and consistent with public health guidance, and that employees are aware of these policies. And there's a lot of resources you'll see later on in the presentation, links to different websites that contain current policies, state and federal, on how to properly address these types of issues. You also need to be aware of other companies' employees who may be at your work site, including temporary employees, contractors, salespeople that may arrive at your door, to make sure that they're aware of what your policies are. Do not require a healthcare provider's note for employees who are sick. Basically, the more difficult you make it for an employee to not come to work, the more likely they are to come to work. So you know, you want to make it as easy and hassle-free as possible. So in this case, you know, what the recommendation is, not to require a note. A verbal, you know, I don't feel good, etc., should be sufficient under these conditions for not coming to work. Next slide. Okay, maintain flexible policies. Again, kind of repeat from the previous slide. But if it's for somebody that needs to take care of a sick family member, even if they personally are not showing symptoms or feel that they may have contracted the COVID, that don't come to work, because obviously they have somebody that could use their help at home, and secondly, and equally importantly, is they're around somebody that's sick and they could have it and not know it. Second sentence there: recognize that workers with ill family may need to stay home to care for them. And there's a link there to the CDC guidance to give you information on preventing the spread of COVID. And you know, that's something you should check frequently, as you know, it's still somewhat fluid at this point. Information changes, but the link is there. And the last item there: be aware of workers' concerns about pay, leave, safety, health, etc. Fear of you know, not receiving a paycheck, or potentially disciplinary action could completely derail everything you're trying to do to prevent COVID from getting into your workplace and transmitted among your workers. So you have to make sure that you know, your workers are clear about what your policies are and that there isn't any fear there. Next slide. Okay. So this is more relating to the training side of it. Provide adequate, usable, and appropriate training, education, and informational material. What are the business essential job functions? What do the workers need to do to be safe and to protect themselves? Proper hygiene, use of workplace controls, including PPE. You know, pretty much the company's policies on how they expect employees to conduct themselves to control this situation. All right, next slide. And the first sentence on this slide is kind of a reiteration of what I mentioned earlier. Informed workers who feel safe at work are less likely to be unnecessarily absent. And this information obviously applies beyond just COVID. It would apply with pretty much any workplace you know, risk. Work with insurance companies and state and local health agencies to provide information to workers and customers about medical care in the event of an outbreak, which we obviously are in an outbreak. But you know, just another resource. Insurance companies, in addition to the other government agencies and information that's available throughout this webinar, the links, and that there's one slide toward the end that covers even more local Western PA places that you can go for information. Okay, next slide. All right, now we're moving into workplace controls. So this would be another step within the 6 steps that are addressed in this webinar. The workplace controls that are recommended are in order of preference or order in hierarchy or engineering, administrative, safe work practices, and personal protective equipment. Now this hierarchy of controls is nothing new. These are the same controls and hierarchy that you would use for any workplace hazard, but it's applied more specifically toward COVID or any similar type of outbreak. Okay, so what I'm going to do, just go through engineering controls first. Engineering controls are the preferred method in any hazard control, because you eliminate the hazard, and once you do that, then you don't have to worry about employees following necessarily if they're having a PPE requirement or work rotation or things like that. If you can eliminate the hazard, then it's 100% corrected. Examples that are relevant to COVID would include high efficiency air filters for the air handling system that would capture any airborne pathogens. Increased ventilation rates. Most, especially climate controlled buildings, are designed to be efficient, especially in when there's air conditioning or heating, to not provide additional ventilation, but in a unique situation like we're currently facing, those ventilation rates, it would be potentially could reduce the transmission of pathogens, airborne pathogens, because the more air you're moving, the less likelihood that you have stagnant air in certain areas, or areas where there's high concentrations of people that may retain whatever airborne contaminants are there. That if you additional ventilation would help get that out and get it filtered and get minimize the risk of something staying in that workspace for an extended amount of time. Another engineering control, physical barriers, plastic sneeze guards. You know, we talked earlier about if we want to have an isolation area, you know, a separate room, that would be a type of engineering control. Drive-through windows for customer service. A lot of businesses are already set up with this. Some may be able to implement a version of a drive-through on a short-term basis if need be, or even have you know, employees or customers, for example, that would have to just pull up and the employee could bring out their product. And the last one, there's specialized negative pressure ventilation, and that would be more oriented toward medical facilities. If a sick individual would need to be isolated, but where there's still access, and a healthcare professional may have to interact with that sick individual, a negative pressure enclosure could be used to ensure that nothing is able to seep or come out of that enclosure. The negative air would ensure that anything that would come out would go through a filtered air system. Next slide. Okay, the next control in our hierarchy of controls is administrative, and this would be the second preferred option. Obviously, the first one encouraged sick workers to stay at home. Minimize contact among workers, clients, and customers, replace face-to-face meetings with virtual communications, and implement telework are two examples. And these webinars are a perfect example of that. But a lot of businesses have already implemented stay-at-home work to the extent possible. And as technology improves, there may be additional ways to do this even in the future. Alternate days or use extra shifts to reduce the number of people on the site. Brian mentioned earlier staggering shifts, or maybe if a company that normally only works one shift, maybe work 2 shifts and have half the number of people for each shift. Or possibly just alternate days, half the people work one day and half the next day. There's a lot of creativity that could be utilized as far as trying to minimize the number of employees on site at one given time. Discontinue non-essential travel, and the CDC website has a traveler's link there that will let you know areas that have or more at risk currently on an almost daily or a daily basis, areas to avoid. And develop emergency communications plans. So most companies would have something in place already on this as part of their normal emergency action plan, but there could be unique features to include as far as maybe places to contact for specific SARS or COVID-related questions or issues. Next slide. Additional administrative controls provide up-to-date information and training. So as new information becomes available, as you learn about it, make sure you share that. And the training, as mentioned earlier, specifically with regard to PPE, how do you put it on? How do you take it off? How do you clean it? Excuse me, how do you maintain it, and when's it required? And if you need a replacement, where do you get it? Which person within the organization is your equipment provider? And training, as with any safety and health training, needs to be understandable and available in the appropriate language and literacy level for all your employees. And that concludes my portion of the presentation. I will turn it over to Rick Mason.
Hi, this is Rick Mason. I'm another consultant with the PA OSHA Consultant Project program. I'll talk about work practices. A little bit redundant, but they're all wrapped up here on one slide. Provide resources in a work environment that promotes personal hygiene. So have tissues available, have no-touch trash cans, hand soap available, alcohol-based hand rubs, something containing at least 60% alcohol, disinfectants available, and disposable towels, both for hand washing and for workers to clean their work surfaces. Require regular hand washing or use of the alcohol-based hand rubs. So require workers to use them, post hand washing signs in the restrooms, reminding people. Personal protective equipment that may be used with the COVID-19, gloves, goggles, face shields, face masks, and respiratory protection. Recommendations may change depending on geographic location, risk assessments for workers, information on PPE effectiveness in preventing the spread of COVID-19. So there's new information coming in all the time about what isn't working. So it's important to stay up to date. So check the OSHA and CDC websites regularly for updates about recommended PPE. And we'll have links for those at the end of the presentation. So general requirements need to be selected based upon the hazard to the worker. Still talking about PPE, must be properly fitted, periodically refitted as applicable, consistently and properly worn when it's required, regularly inspected, maintained, replaced as necessary, and properly removed, cleaned, and stored or disposed of as applicable. Avoid contamination of self, others, the environment, or taking any contamination home. Respirators, they're required if you're within 6 feet of patients known to be or suspected of being infected with SARS and when performing procedures. A lot of this respirator information is applicable to healthcare settings. NIOSH is the agency that approves respirators for occupational use in the United States. N95 filtering face piece respirators or better. There are temporary alternatives on the market right now. So in the healthcare setting, most people are using the blue-coated N95 filtering face pieces that are also approved as surgical masks by the Food and Drug Administration. NIOSH is saying right now, because there's a respirator shortage in the healthcare setting, you don't have to use the surgical masks except if you're performing surgery or some other procedure. So they're recommending to minimize use of those by using other N95 respirators. They also right now have issued some different waivers on the types of respirators that you can use or temporary alternatives. There's a link there to that site. And one of the things that OSHA or that NIOSH has approved is respirators that are certified in other countries. So if there is some availability of a respirator that's been through an equivalent approval process in another country, equivalent to the N95 or better, that's an alternative for you. I know there are a lot of, I've heard of some KN95s, the prefix K, coming from China, and they're on the list, as are several other countries. You're required to have a comprehensive written respiratory program that includes fit testing, training, and medical exams. There's the link to the OSHA regulation there. But OSHA has issued some temporary guidance on annual fit testing. The reason is when you do a fit test, you consume a respirator. You sort of waste a respirator. So OSHA right now has waived the requirement for annual fit testing during the COVID-19 response. The waiver went into effect, I think, on the 20th and stays in effect until they lift it. So be aware of that. Now, if you're a first-time user or a new user of a respirator, you still have to have fit testing to make sure that respirator fits you. This is just applies to the annual retesting. Also, they say N95 or better. So be aware there are other acceptable respirators on the market. N's a designation that just means non-oil resistant, and 95 is the efficiency. So they're also available in the workplace or in the market. Prefix R respirators, which is oil resistant. Prefix P respirators, which is oil proof in the 95 efficiency. There are also NP and R respirators that are 99% efficient, and NP and R respirators that are 100% efficient. So just realize you're not restricted to N95 respirators. Any of these are equivalent. Also, there are powered air purifying respirators, and those are available for use too. So, and elastomeric, which is, you know, the rubber face piece, either in a half face with canisters. Those canisters have to be rated NPR 95, NPR 99, NPR 100. But you can use, you know, the regular respirator rather than just the filtering face piece. So there are several alternatives out there to the traditional N95 filtering face. The OSHA standards still have to be followed, and there's some links here. See them. The general industry standards apply to the use of gloves, eye, face protection. and specifically the standard that applies to respirators is 1910-134. Also, OSHA is enforcing, so the OSHA standards that apply. General duty clause just says that an employer has the duty to provide a workplace place of employment free from recognized hazards that are causing or likely to cause death. That's sort of the catch-all OSHA requirement. OSHA also has a bloodborne pathogen standard, not 29 CFR 1910-1030, that applies to occupational exposure to human blood and other potentially infectious materials that typically do not include respiratory secretions that may transmit SARS, COVID number 2, the COVID-19 virus. But they offer a framework that may be helpful to control some sources of the virus, including exposures to bodily fluids, including respiratory secretions that aren't specifically covered by the standard. And there's a link to the bloodborne pathogen standard there. Some additional resources available, sort of customized for Western Pennsylvania. There's a lot of information out there. There are a lot of resources. So we boiled it down to what we think are some fairly essential resources. The CDC, the Centers for Disease Control, a lot of these other sources are also relying on CDC. So go right to the source. Information on COVID-19. Information specific to workers and employers. OSHA has set up a COVID-19 page. And as I mentioned at the beginning of the presentation, a lot of the elements of this presentation came straight out of their new publication, 3990. And there's a link to that publication. Pennsylvania residents, they're wondering about the stay-at-home order, waivers, and the status of cases in Pennsylvania. There's a great PA site listed there. Employees about how concerns about unemployment, workers' compensation benefits, that sort of thing. There's another PA site specifically devoted to that sort of information. And a lot of the counties and smaller population counties don't have a lot of current information. But Allegheny County has an active website for residents of Allegheny County. And they also set up an 800 number, 888-856-2774. And that's available in several languages, and that list of languages is available on the website. Okay, we'll be looking at your chats and getting back to you. Just a reminder that if you'd like to work with the PA OSHA consultation program, you can go to our website, www.iup.edu/PA- contact us directly at our 800 phone number, at our website. We also have Facebook, Twitter page. I hope you found our presentation useful today, and we hope to hear from you with any questions you may have.